Welcome to another episode of Dr. Doctor, the award-winning radio show and podcast featuring your physician hosts, Dr. Tom McGovern
and Dr. Andrew Mullally, where we and our guests discuss relevant and health-related topics from an authentically Catholic perspective. Dr. Doctor is brought to you in part by the generous underwriting of CMF Curo. Learn more at mycatholichealthcare.org and live your Catholic faith in your healthcare with CMF Curo.
Today's guest will be heard across the EWTN Global Catholic Radio Network. Joining us for the first time, I think, we have a pharmacist, Dr. Micahel Magallanes, a doctor of pharmacy who is also board certified in geriatric pharmacy. Today's topic will be vitamins and minerals, the good, the bad, and the unnecessary. Andrew, we haven't covered this subject before. Why now?
I'm surprised we've made it 300 episodes or however many we're at now without covering it. I mean, this seems in some ways foundational, but it's a big topic. It's a big topic in the lives of our patients and probably our listeners, I assume, and people want to know about it. What is there to know about vitamins and minerals? And I don't know, Tom, are you an I Love Lucy fan? Have you ever watched that?
Vitamin to Vegemin.
That's right. I'm queuing the Vitamita Vegemin, and I can understand why everybody loves it.
Had you watched that?
I can understand why people love it so much, but a lot of them are not intoxicating like the I Love Lucy skits. Most of them are just boring old pills. And so, what's the deal? We brought in a pharmacist today to help us understand, because vitamins are not, I'd say, without controversy, right, Tom?
Yeah, a lot of people think that, everybody, of course, would want to take a multivitamin. Well, would they? Why? I remember back when I was an intern, like in 1990 to 91, and internal medicine residents were all taking a baby aspirin and vitamin E to reduce the risk of heart attack. Okay, where is that now, Andrew?
Right. It's back in the dustbin of yesteryear.
Both of those things.
Yeah, it's the part of medicine, half of what you're learning is going to be proven wrong. You just don't know which half,
Right.
And that's one of those things. And there's so many examples in medicine, but vitamins, it does seem like things go in phases, things are very in style for a while. And then sure enough, new kid on the block. We've all forgotten about the old ones,
Right. So I think it's good for people to know, because a lot of people think, I take vitamin C when I have a cold, or zinc when I have a cold, because it helps and there's evidence for it, right? Well, is there? We're going to cover that. I mean, even in my own family, they will do things that I think aren't supported by evidence, but it's like in the air we breathe. It's amazing.
Well, and Tom, what in your mind is the difference? Because we talk about evidence an awful lot. But there's different types of evidence, right? And so a lot of times when I'm talking to patients about evidence, I try and reference some kind of study from some kind of journal that
Yes.
maybe they've heard of or is respected in some way. But there's another type of advice that I think is even more powerful, and that's anecdotal advice.
Anecdotal.
What's the difference?
Aunt Susie took zinc when she had influenza and she got better in 2 days. It was the zinc, therefore. Yeah. And it's like, well, Aunt Susie probably did a lot of things, and maybe Aunt Susie didn't have the flu. So in other words, when you hear stories, there might be truth to it, but studies are putting together hundreds of stories. And then you find out what's really true. And not only are they putting together stories, but they're actually looking at, will this one thing make a difference when you've ruled out all these other things? So it's a much more clean look at what might be making a difference. Whereas these other stories are just that.
It seems like there might be a chasm in understanding, though, and in discussion, because I come at patients with these studies I've read, and they kind of maybe roll their eyes a little bit, like, is that from the CDC? I don't trust anything from the CDC. Or patients come at me with stories about Aunt Susie, and I'm like, come on, really? Everybody's got aunts, that's one story. How can we bridge that gap when I think we rely on different evidence is most important.
I think, something I've learned is that when you are being told a story, it activates many areas of your brain, including emotional areas. A study doesn't do that. So somehow we have to figure out ways to make that study a story. We talk about, well, here's 100 Aunt Susies and 100 Uncle Johns and 1,000 cousin Georges, all put together in here. And this is what we found out really works. I don't know the best way to do that, but you're right. The stories make such a difference to us. That's why they're used in advertising.
Yeah, that's the truth. And honestly, I hope that's one of the things we can kind of talk about today as well. We're going to be going through a lot of different vitamins, but doctors, we're infatuated with the data and we're trying to bring evidence and numbers and all these things to help us make good decisions. But it's trying to figure out the best way to act. And ultimately, one of the things that I always try and introduce to the conversation with vitamins as well is this idea of the placebo effect. Right, Tom?
Yeah.
We've
Oh,
talked
that's
about
big.
that on this show before.
Yes.
If I prescribe, actually, I had a doctor friend who told me in other countries they have a sugar pill that they can prescribe for people. It seems a little unethical, but in other places they do prescribe placebo
Wow.
pills, which I forget who we were talking to, one of our previous guests. They said that the placebo effect might be even somewhere around 40 or more percent effective, where if you do anything, if you wear a green shirt when you have a cold, you're going to feel 40% better because you wore your lucky shirt. And to what degree do taking vitamins or taking anything fulfill that, and this is to be differentiated though from supplements. That's something that we're not going to try and cover today, right, Tom?
Because there's so many to cover. We'll hopefully get through the vitamins and maybe even minerals. But supplements, you think of things like ginkgo biloba or turmeric. Those are not in this show because when I started making the list, it's like, oh my goodness, there is no way.
Yeah.
So we
and
want to do them justice
and Tom, what do you think some of the big reasons are people take vitamins?
because they think they need them to be healthy.
Okay,
They
the
want, they
pursuit
think
of
they need
health.
to feel better.
All
What,
right.
what do you think?
I think so too. And I think a lot of people want to feel like they're doing a good job at checking the health box. And
Ah, yes.
I see people a lot of times, especially in the New Year resolutions. I'm going to go see the doctor. My wife's been trying to make me, and here I am, sure enough. Okay, what do I actually have to do to be healthy? Here I am. And a lot of times when I don't have, 12 vitamins to recommend, they're like, is this guy a quack? What's he talking about? I thought I'm supposed to do all that stuff. But, really, I think one of the main things about health too is that there's no pill that's a shortcut to the hard work of eating a healthy diet,
Correct.
even when you want junk food, and exercising, even when you don't feel like it. And you can't shove that in a pill. We don't have one as of right now.
We don't. And we're going to learn about what we do have in those vitamin pills, but after the medical trivia question of the day. And the topic is flip the page.
Vitamin
Oh,
veg.
yeah. The American need for vitamins and supplements. Vitamin to Vegemin would be a more interesting one.
Maybe
Yes.
next
What color
time.
was Lucy's hair in that episode? No. The question, a 2019 Harris poll for the American Osteopathic Association, so those would be the Association for DOs, Doctors of Osteopathy, as opposed to the AMA, revealed that 86% of adult Americans take some vitamin or supplement. 86%. Of those taking them, what percentage of them had evidence of at least one nutritional deficiency that would warrant taking them? By the way, I do take one vitamin myself, but only because I have a demonstrated deficiency. So what
Extra
percent of that
credit if you
80?
can guess what that is.
Oh, bonus. But you're going to have to wait till the end of the show right here with Andrew and me here on Dr. Doctor. Welcome to our guest interview today on Dr. Doctor. We have with us today Dr. Micahel Magallanes. Michael is a doctor of pharmacy. He's also a board-certified geriatric pharmacist. He's been practicing for several years and now works at a forensic hospital in California. He also, in his spare time, writes articles on supplements and alternative treatments for common ailments. His interest in this started when he was working as an intern with the FDA, and he learned about investigations into adulterated and misbranded products. Yes, it does happen. And his interest continued when many patients and family members asked him for advice about supplements. So, Michael, welcome to Dr. Doctor.
Thank you for having me.
So, Michael, as the first pharmacist we've had on Dr. Doctor, what is it that led you to decide to go into a career in pharmacy?
Well, it started as a child. I grew up next to a hospital, so I had an early exposure to the healthcare field. And I did some volunteering. I worked near the patient's bedside. But ultimately, after a short training as an EMT, I realized that blood and fluids were not for me, and I wanted more of a hands-off. Yeah, I wanted more of a hands-off approach where I could help patients a different way. And so it also started to in the home because when we got sick, my mom would always recommend natural homeopathic remedies and this kind of old wives kind of a traditional medicine, old-fashioned medicine, and so I kind of grew up with that curiosity of why is it that people take medications, and those medications, are they necessary? So I went into pharmacy school thinking I would help patients, and then I learned that the world of pharma is very complicated. From the prescription drugs to even the OTC drugs. So it's been a very interesting experience, and I really enjoy doing what I do currently. But I'm always learning new things, so it's a very interesting field.
So, even apart from your day job, you've started a blog that helps educate the public about various prescription and OTC meds and supplements. Tell us about that, how you got interested in that.
Yeah, so like Dr. McGovern, Tom said, I did a short stint at the FDA, and it was there that I had an eye-opening experience of what goes on in the manufacturing of supplements and vitamins and all these other over-the-counter products. And what I learned is that the FDA doesn't really regulate supplements or vitamins. They only regulate food. So supplements and over-the-counter products, some of them at least, not all of them, are considered food in the eyes of the FDA. So they can't prevent manufacturers from putting products on the shelves. They can only cite them for, misbranding or adulteration. And so it was there that I realized, this is actually a big deal because a lot of people consume these products. They spend a lot of money and they put these things in their bodies, and they don't come without risks. So and then coupled with the fact that I worked in a pharmacy during my school days, I also got a lot of questions from patients, and I still get questions from patients and family about, what should I take for UTI, or what should I take for, inflammation, or what should I take for, common cold, and so um, it's kind of surprising to me that people still, resort to vitamins as kind of a natural way to treat their common ailments. But it's very common, as you probably know as doctors, that patients like to self-medicate, and they kind of come to you already with an opinion of what they have. So that's kind of why I wanted to do this blog, and I'm hoping really to bring transparency to the supplement field, because there's a lot of myths and a lot of fads going out there that people just take it with good faith that it's accurate, and there's a lot of misinformation.
Yeah, tell us, for the purposes of our discussion, what is the difference between a vitamin and a supplement?
So vitamins are just a general term for just micronutrients that already exist in foods. So you have your common vitamins A, B, C, not like that, but you have vitamin A, E. So that's a micronutrient. And supplements can also be vitamins, but when you say supplements, usually you're referring to like health promoting products that are not just vitamins. So, for example, a protein powder could be considered supplements, or um, like turmeric is a supplement, CoQ10. So these are other, I guess, products that are not necessarily found naturally in food.
Tell us a little bit. You had kind of referenced the ability of the FDA to supervise supplements and foods. How does that compare to the supervision of drugs, prescription drugs? Because I have a lot of patients tell me they prefer supplements because they don't have all the side effects listed that the prescription drugs do. How is the supervision different?
Yeah, so I mean, prescription drugs require a lot of clinical trials, and first, they have to go through different phases, one, two, three, and they have to have safety and efficacy trials. So they're very rigorous um, standards that are applied to prescription drugs. On the contrary, supplements don't have that. They don't have that strict guidelines to follow. For example, anyone like you or I could just take an off-the-shelf template for a supplement, just copy an existing one, and then label it with your own brand. And you could say, "Oh, this is an immune booster," or "This is, um, whatever you want to say it is." The only
And you
difference,
don't have to prove it, do you?
no, well, you don't have to prove it, but it does. It better have, it better not have like health claims like this will cure cancer. Otherwise, the FDA will come after you and they will shut you down at the very least. So, yeah, that's kind of the main difference.
So you can say it does something in general, but not specific.
Right? Yeah.
Or it doesn't, or you can't say it cures something. You can say it makes something better, but you can't say that it treats a specific ailment. Is that right?
Yes. Exactly. Yeah.
And
So, so
you said,
vitamins, do they make sure that those contain what it says on the bottle?
So some do and some don't. Um, and so that's why there's different third-party testers like USP, the United States Pharmacopoeia. Then there's NSF. That's another third-party tester. Those two are the most reputable ones because they do test directly from the manufacturer, and it's somewhat anonymous. And the USP is a little bit higher reputation just because they test frequently, like multiple times per year, versus the NSF does it maybe once a year. So um, that's that's a very good question because you know um, you want to make sure that what you're taking, what you're putting in your body, is actually what the product says it is. And unfortunately, there have been cases where people have taken or bought something and it turns out that what's in the bottle is not actually what it's supposed to be, or there's extra stuff that they didn't want to be in there and might actually hurt them because they're on a certain medication. So I don't know if that answers your question there.
Well, is there a way for people who are buying these things to know what they can trust and can't trust? Because it seems like people, they go into, a vitamin store or a nutrition store, and I can trust everything in every one of these bottles. Is that true? That they should trust it?
Yeah, no, absolutely not. I would say there's very few products you can trust, with the exception of the ones that are labeled USP or NSF, and there's other ones like UL is another one, and um, there's new companies coming out like Consumer Lab, and they're trying to bring transparency to the supplement world, but you'll find many products on the market that the most they will say in terms of certification is good manufacturing practices, which is what the FDA requires to, in terms of their guidelines of avoiding any tainted product, any and poor hygiene, mixing it with soy products or nut allergies. So those are the good manufacturing practices that a lot of bottles will kind of settle for because that's the very minimum that people kind of expect. But you also will just see products that say, vegan or soy free and, made in the USA and, not animal tested. So these are all like fun kind of good feeling labels, but they don't really mean anything for you and your health.
Is there a difference if, for example, sometimes we'll prescribe vitamin D for patients as a prescription that they pick up from their pharmacist, and then other times patients might pick it off the shelf or order it online. Is there a difference in quality there? Or if you find that USP or another designation like that, that's adequate?
Yeah, a lot of the times you can get vitamin D off the shelf, and if it's USP, and if it's still meeting your requirements, that's great. But a lot of times that's for maintenance, and usually when you're prescribed something by your doctor, by you guys, it's usually a very high dose. So it's at that point they've already determined that you are, deficient in vitamin D. You really need this, so they're gonna give you like basically a boost shot and kind of get your levels up. And then once they're back normal, then you can go to a maintenance, a lower dose. So initially, it would benefit all patients to go with the prescription, especially because it also is paid for by most of the times by insurance. And if you're lucky, you could even ask your doctor to write you a prescription for over-the-counter vitamin, and that could sometimes even be covered by insurance. But yeah, that's another different issue.
So, and then one more big picture question before we get into the specific vitamins, and that is, how reasonable in general is it to assume that a vitamin taken above what the body normally needs, the recommended daily allowance, how reasonable
Yeah.
to assume that dose is going to help any particular disease?
It's not reasonable at all, because most people who take vitamins are generally healthy. We are fortunate, we're blessed to live in a country that has a lot of resources, and most people get their vitamins from their food. And there's been a lot of studies done on, on disease prevention of disease, and most of them haven't been observational. So meaning that they've seen they've seen a link, but it doesn't mean there's a actual correlation there. So they're trying to do, a lot of companies and even the government, they're trying to do more clinical studies, but they haven't really proven, and there have been a lot of inconsistencies in terms of if vitamins have any benefit in preventing cancer, for example, or chronic heart failure. Um, so I would say, yeah, it's not very reasonable to assume that supplements will.
Well, in fact,
Yeah.
when Andrew and I were just talking, he mentioned that the U.S. Preventive Services Task Force just came out with what, Andrew?
Yeah, there was I always love referring to them, mostly because their initials are so long. But it seems that one of their pieces of evidence suggests that there's insufficient evidence for taking multivitamins or paired supplements to prevent cardiovascular disease or cancer, as you
Which
were
Michael just
alluding
mentioned.
to.
Yep.
Yeah, which for them to make a statement, it's usually pretty well documented, I'd say.
All
Yeah.
right. Well, let's go through the vitamin aisles of the grocery store, starting at the beginning of the alphabet. Vitamin A. What is it and why do we need it, Michael?
So vitamin A is just one of the common micronutrients that you can find in food. You'll get from your food. It's important for many biological actions, but primarily It's important for your eye health. So in your retina, there's several vitamin A binding proteins, and so if you take it through your food on a regular basis, it will help maintain the health of your eye.
And so if you take more vitamin A than you need, does it make your vision even better?
No, no. In
What
fact,
happens if you take too much of it?
well, it can be toxic. Their doses of single dose of greater than 200 milligrams can result in actually it's not healthy for the pregnant female. There has been cases of teratogenicity in
Oh,
females who've taken really high doses of vitamin A. So that's one thing. I haven't seen any other commonly reported cases of vitamin A toxicity, but
sure.
yeah, but that's the main one that I know of.
And it might be good to go into the difference between water soluble and fat soluble and which ones can build up and which can't.
Right. So vitamin A is one of those fat soluble ones, and also vitamin K and D and E. So the most toxic one is D, and then followed by A, and then K and E. So they're just they're fat soluble because the body absorbs them and they're stored in the liver mostly, and in some other fatty tissues. So the other water-soluble ones are, B and trying to think of
And C.
and C, right? So so those ones are mostly flushed out, but I think B12, it's kind of in the middle ground. You do get
Okay.
some absorption, but most of it is flushed out.
Let's move on to the B vitamins. I don't know why they didn't just go A through Z, but they stopped at the Bs and did several of them. But the first one that we want to make sure we discuss is B3, nicotinamide.
Yeah,
Tell us about B3. Why do we need it?
right. So B3, sorry, just so B3 is the coenzyme that's involved in. Sorry, I just blinked. Okay. Is this recording?
Yep, but our producer can cut and
She cuts
paste.
and pastes it for us.
Okay. So, yeah, so good question. So actually, nicotinamide is a form of B3, but actually niacin is, there's niacin, there's nicotinamide, and there's nicotinic acid. So the most common supplement you'll see is niacin B3. So this is basically in all the tissues of your body, and B3 is converted into the main active form of niacin. So this supplement is used to convert energy into energy from your skeletal muscle into energy. So, and it also helps produce ATP.
Which is the main energy molecule.
Yeah.
Who would it be good for? Should we all take some more of it, or is there a dark side?
So, yeah. So we should not all take this. So the dark side is that large doses can cause adverse effects like hypotension, falls, fatigue, impaired glucose tolerance. These are some of the common side effects from too much niacin.
So who might need it?
So it's been used for a few things, but mostly people who have malnutrition. So if they have anorexia, or if they have, like gastric bypass surgery, or if they just are poor absorbers. So people like who have inadequate riboflavin or iron intakes, that can also be a case where they have low B3.
And we didn't ask you, are there any drug interactions between vitamin A or niacin? Are there any drugs you shouldn't take them with?
Oh, so either of those? Okay.
Yes.
Right. So niacin, to my knowledge, I don't believe there are.
Okay.
Yeah.
Okay. You just tell us what are the dark side interactions with some of these.
But
when we get to them.
vitamin A does interact with isotretinoin, so it's a common acne medication. And usually, when doctor starts you on this, they'll suggest that you stop taking a vitamin A supplement.
Exactly.
Yeah.
And in my world, the nicotinamide or nicotinic acid or niacinamide actually in studies has been demonstrating people that get a lot of skin cancers to reduce them by 20 to 30%, starting a month after you take them. And it may have to do with the fact that it helps produce energy in the cells, and here the energy to help the skin cancer, the cells that get damaged by the sun, to actually repair the DNA damage. So it's interesting that there is evidence for that. And I've got some of my frequent flyers patients on it for that reason. Let's go on to, so vitamin B6, pyridoxine, what is it and what does it do?
Right. So it's a coenzyme um, that performs a wide variety of functions, and it's involved in more than 100 enzyme reactions, and it's mostly concerned with protein metabolism. So it's also involved in gluconeogenesis, and in your immune function and in a hemoglobin function.
So, who would need something like this? Is it going to be a repetition here? People who are malnourished to begin with?
Yeah, so there's that. There's also been cases where people who are pregnant, they've used it to prevent preeclampsia or eclampsia.
Oh,
Yeah, and it's also very common in smokers to use it because the oxidative stress from smoking can deplete your vitamin B6, and um, it also wouldn't hurt a growing child to be supplemented with this because they're in the developmental phase.
Hmm. And what if any is the dark side to this? Any bad things about B6 we got to watch for?
Yeah, um, so if you have too much of it, it can lead to neuropathy because it just overexcites the sensory neurons and it's kind of they don't really know what that is caused by, but it has to do with the GABA signaling. I don't know if you know what GABA is. It's excitatory neurotransmitter. So that's kind of worst case scenario. And usually on the bottle, I have one right here in front of me. Um, they'll give you, let's see, 2 milligrams. So that's still below the upper limit of what would consider toxic.
very
And
good.
B6 is one that I'll see sometimes advertised in like energy drinks. Is there a thought process there?
So there is a thought process there. So as I mentioned, it's involved in converting energy from fats, carbohydrates, but it's not going to be really that effective at giving you a lot of energy. You're probably better off just drinking caffeine. Um, yeah,
Get down to the good stuff, right?
yeah, yeah.
And we're about halfway through the interview, so we're going to take a break now and come back on the other side of Doctor with more information from Michael on vitamins.
And we are back with Doctor, and today we're talking about vitamins. Michael, can you tell us a little bit more as we're going through these vitamins? I know there's a lot of B vitamins. What should we know about B7, biotin?
Right. So it's similar to B6. It helps with metabolizing fatty acids, glucose and amino acids. It also helps in gene regulation and cell signaling. But the Food Nutrition Board wasn't able to find data sufficient to derive a RDA or RDI. So you'll still find it sometimes in supplements, but you can get most of it from your food. So that includes eggs, fish, meat, nuts, and sweet potatoes. So it's not necessary to take, but there is a lot of hype that it might be used for hair and skin, and they just have,
Oh, yes.
yeah,
Yes, there is.
It's funny, the people, at least the people I see taking it, worried about the hair and skin, are the thyroid people. And it can be a fly in the ointment for us because I think it interacts with the way we do the thyroid testing, right?
yeah, right, right, yeah. So there are some biotinylated assays that can be affected if you take too much biotin. So that's not to say you can't take it, but you would want to at least stop it for 24 hours before you get a thyroid test. It's
Well, the next B vitamin is a real common one that we hear about. People are often even taking shots of it, and that's vitamin B12. What's the big deal about vitamin B12?
So yeah, so B12 is commonly thought to help with energy. It's another water soluble vitamin, but um, so hmm. I was going to say something and I blanked. But right, so B12 is required for development and for the central nervous system and for healthy blood cell formation, as well as DNA synthesis. And usually you'll find it in your supplements, in your vitamin bottle, um, around 2.4 micrograms. That's the kind of recommended daily value that you should be taking.
But is
And
it true that older adults are more likely to be deficient in it than any other group?
not necessarily. I mean, as long as they're having a balanced, healthy diet, there's no
Okay.
there's no good reason why um, adults would be deficient in it. There's
When,
yeah. The only
when
Go ahead.
patients get shots of B12, they all swear up and down to me that they've got more energy. Is that just a placebo effect, or is there something going on there?
So yeah, so it does have a role in energy, um, but it has no beneficial effect on performance. Um, so it really is most likely just a placebo. They haven't determined. There have been a lot of studies, and there's no real proof that it can boost your energy. A lot of times, those boosters are combined with other stimulants like caffeine, and that's the most likely reason why they're feeling, energetic.
Gotcha.
Yeah,
I guess before we move out of the B vitamins, the other one that gets a lot of press historically in pregnancy is folic acid, vitamin B9.
yeah,
What should we know in general about B9 or folic acid?
yeah. So B9 is an important one because, it comes from the Latin word folia, so which is why you find a lot of folic acid in spinach and leafy greens. Um, So it's importantly used in pregnant women and lactating women, as well as children, because it um, help with developing the spinal cord and the central nervous system, um, and yeah. So
Yeah, it prevents neural tube defects like anencephaly or spina bifida. So
mhm,
that's, yeah, Dr. Jerome Lejeune discovered that way back in the early 60s. That was a wonderful thing. So that would probably be highest on the list of things we've covered so far that has a definite, very positive benefit,
right.
at least in my book. So, vitamin C. I've got a signed copy of the book that Linus Pauling wrote about how vitamin C can cure just about anything. Of course, he was wrong. But
Yeah.
what's the big deal about vitamin C?
So vitamin C, also known as ascorbic acid, you find it in a lot of food, and really, it's important to help promote synthesis of collagen, also certain neurotransmitters, and it's involved in protein metabolism. Um, so it's also an antioxidant. Um, and the truth is, it's been really promoted as a supplement that you can use to help with fighting colds, but there hasn't really been any studies that prove that once you get sick, it's going to help diminish your symptoms.
Yeah,
So,
I kind of wonder if there's somewhat of a drying effect with vitamin C, so maybe there's less. One of the things that I get to help people with sometimes is with infertility, and I had one lady who didn't have a mucus cycle because she was on so much vitamin C, and she
oh
discontinued
wow,
vitamin C and got pregnant. And
wow.
so I've always kind of wondered, do you think that's a mechanism for why some people like it for cold symptoms, or hard to say, just all marketing?
Are you referring to, sorry, the mucus, or what was I guess the
Or
benefit?
like just generally drying up nasal mucus, for example, with cold symptoms.
Yeah.
Um,
So it
or is
does.
it mostly hype, I guess?
Well, vitamin C actually does have a antihistamine effect. So there's that. Um, So it could be there, but it's not likely going to really help prevent the duration of your cold.
Gotcha.
So the studies have been looked into. It doesn't help. So it's not that it hasn't been studied. It has been studied. Isn't that right?
Right. Yeah.
So, and the classic example of not enough vitamin C was scurvy. You know, the old time sailors, until they discovered that limes would help solve it. So they were losing teeth. They were bleeding from everywhere. They get little corkscrew hairs.
Mm.
They don't heal. It's a mess. So if you have enough, it prevents that. But more, isn't it true that with the B vitamins in general and C, if you take more than you need, it just goes out in your urine?
Most of it, yeah, except for B12 is one of those weird ones that some of
Right.
it does get accumulated. Um, but yeah, that's the only one. Most of them do get excreted in the urine.
So one that doesn't get excreted in the urine typically is vitamin D. And there's been a lot of ink used over the last 20, 30 years on this one. So why the excitement about vitamin D?
So yeah, there's has been a lot of studies, and they're trying to still determine if it helps prevent fractures. But it's used to promote calcium absorption in the gut, and which is, as we know, important for bone health. It prevents osteomalacia and osteoporosis in adults. Um, but according to you know some studies that I looked at, it didn't necessarily prevent fractures, but it did prevent falls in some elderly adults because of the effect it has on the muscles. So vitamin D has
Oh,
some
Wow.
role in muscle contraction. So there's
yes.
been some scientific support there in that area.
So vitamin D is a kind of an interest of mine, maybe for everybody. But I always love things that are a little controversial, trying to figure out what's going on here. So I'm in family practice. I test people's blood all the time. A lot of people want to test vitamin D. I've met one person with a normal vitamin D level who's not supplementing. Everyone else, 99.9% of people have a low vitamin D, which makes me wonder, how in the world did we get this normal range? Is it really normal if you can't find it in nature? Do you know anything about that?
Oh, right, the normal. Yeah, so I know that less than 20 is like, are you referring to like the nanomoles and the nanograms per ml?
Yeah,
Yeah.
most
And
of
then how did
the
they
blood
come up
work
with it?
comes back and it says if you're less than 30, you're low, and 30 to 100 is normal. But I just don't see that ever when we check people's vitamin D. And we are in Indiana, but Tom, you quoted that study previously on the show with the Hawaiian surfers. And
Right.
wasn't it the plurality of them were low in vitamin D, even though they're surfing in Hawaii all the time
Almost
for 6
30 hours a
months?
week with lots of sunshine. Yeah. And they were
Yeah.
low.
So, how do we figure out what's the normal level?
Well, I do know that the Food and Nutrition Board, along with the National Academy of Sciences, have a subcommittee, and they come together and they look at data, and they look at what is the average population, what do they require for bone health, um, and then they go two standard deviations above that, and they say this is the level that you need to have to prevent osteoporosis or osteomalacia. So um, they just base on average dietary intake, and then they extrapolate that out with um, based off of supplements. But um, they don't. Other than that, I don't know how they would determine what's a normal level.
If people, a lot of people are availing themselves to blood tests to check for vitamin D.
Yeah.
It's a common one. If somebody's low in vitamin D and they have a deficiency per that blood test, is it smart for us to go ahead and take it?
No, I wouldn't necessarily take a vitamin D just because it's low. It could be a lot of reasons. They would have to look at your whole profile, your whole medical profile, and ultimately, I would only take something over the counter unless the doctor said, you need this for your health. I would never buy something over the counter if I thought, just because I thought it was low on one occasion, because they might have to recheck it, and it could be due to other reasons that it's low.
So vitamin D, yeah, that's been a wonder. I'm wondering if we're just taking way too much of it. I mean, I know the Institute of Medicine recommends, 400 milligrams for most adults and 600 or 800 milligrams if you're over 60 or years old, which probably isn't going to hurt anybody. It sounds like the best reason to take it are women who need calcium to prevent osteoporosis. It helps them absorb the calcium. Would that be a good reason to take vitamin D?
Yeah, it's not going to hurt you to take it. If you're a healthy adult, as long as you're not overdoing it.
And how much is overdoing it?
So above like 1,000 international units would be overdoing it. So
less than that, we're probably in good shape.
Yeah.
Another vitamin that 30 years ago, a lot of doctors in training were taking, but they're not anymore. That's vitamin E. So what's interesting about vitamin E?
So it's an antioxidant. It's like another micronutrient. You'll find it in the foods, and you'll find it in most supplements. But let's see. So what's interesting about it?
I mean, people think that antioxidants can cure cancer, prevent heart disease. Is that true in the case of vitamin E?
So no, that's not true. What I have seen is that people use it a lot for skin conditions, for eczema and psoriasis, and it's really, what I found is that it's really helpful to help bring the moisture back to the skin, but doesn't necessarily prevent any skin damage from the UV radiation. So that's the most common place setting where I've seen it used. But in terms of preventing chronic conditions, I haven't found anything in my studies or in personal experience that it can do that.
Okay. And, going on through the alphabet here, one of the letter vitamins we have is vitamin K. This might be our last letter vitamin. Tell us about vitamin K. I feel like we talk about that a lot in the newborn health period.
Yeah, so you're right. So yeah, they give you a shot when you're born to prevent bleeding. But basically, it's a coenzyme. It's involved in the synthesis of proteins to prevent blood clotting. So it helps produce prothrombin, and that's why if you have a concern for clotting, they might give you warfarin to help prevent a clot down the line. So
So warfarin blocks the vitamin K dependent part of the clotting pathway, right?
Right. Yeah.
So who needs vitamin K besides newborns?
Yeah, it's a good question. So if you have a deficiency that's been proven by your doctor, that's one reason to take it. In Japan and in Europe, for example, they have done studies, and they've also shown that vitamin K can help improve bone health. So they actually have a health claim that you can use vitamin K for bone health. In the US, the FDA has not approved that claim, but that's one reason why you would take vitamin K as well. But if you have malabsorptions, with like celiac or Crohn's, or if if you have a certain diet restriction, you might benefit from taking vitamin K as well.
And Michael, as we're winding down the interview here, there's really two more big ones at least I want to check on. One is calcium. We're breaking the alphabetical order here.
Yeah.
And then just a general multivitamin. I guess maybe take calcium first. Who needs calcium, and is it a bad idea to take more or a good idea?
So who needs calcium? So I would say growing children, pregnant women, adults. We all could benefit from calcium, but I would say as long as you have a regular, healthy, balanced diet, you wouldn't necessarily benefit from a supplement. Um, in fact, too much calcium could be detrimental to your health. Um, so,
Okay.
yeah.
So calcium ideally for postmenopausal women in particular to prevent fractures, right?
Yes, it has been used in that setting. However, the studies are kind of inconsistent in terms of whether they are that effective for that. Um, Usually, if if you're hypocalcemic, and depending on your bone mineral density exam, the doctor will probably prescribe you bisphosphonate to help improve the density of your bones. That's probably going to be more effective than
Ah,
bumping up your calcium supplement dose.
that's good
And
to
Mike,
know.
tell us, I guess, as we're winding down here, multivitamins in general. There's this thought that everybody needs a multivitamin, or especially kids. Who do you think really needs a multivitamin?
So I would say people who are vegan, people who have malabsorptive disorders, who've had like gastric bypass or celiac or Crohn's. Um, Children could benefit because, as you know, there could be finicky eaters, and pregnant women would also benefit. Those are the general kind of population classes that I would recommend a vitamin for, just a general multivitamin for. But I would stray
I think
away.
that's the most.
Yeah,
I think
yeah,
that's the most rational answer I've ever heard. Good answer. And you were going to say you should stay away from.
I would personally, kind of stray away from picking out specific vitamins um, that you'll find in high doses, because usually usually you can get most of your adequate doses in a multivitamin, and a lot of these other um, single product vials, like for example selenium, will have way more than what you actually need for your body.
So, last question I have is: do you take a multivitamin each day?
I take one, but not each day. I mostly take it when I remember to take it, but I also read my labels very well, and I'm very cautious about what else is in there, because a lot of times you'll find extra stuff that you don't really need.
Such as?
Well, some products will say, has, lycopene, or, um, for example, right here, I'm trying to see, vanadium, boron, you know, and, and then and so also I make sure that when I look at how much is in it, I'll try to avoid where it says, more than 300%. So this bottle I have in front of me is not exactly one that I take, but for folate, it's 250%. So I know personally that I eat a lot of greens and a lot of grains, and so I'm not worried of my folic acid consumption.
Well,
That's it.
Michael, thank you so much for coming on our show and talking about vitamins. I think you gave us some good practical information. Thanks for being with us on Dr. Doctor.
Well, thank you.
And we are back with Dr. Doctor. And Tom, what's the answer to the medical trivia question?
Which was, of all the Americans, 86% of them that take a vitamin or supplement each day, what percent of them were demonstrated to have a deficiency in what they took? And the answer is 24%. Only 1 in every 4 people who take a multivitamin or any vitamin or supplement had a deficiency that needed to be treated, which I found fascinating. I'm one of those people that had, between 20 and 30 on the scale, my vitamin D level. So I'm taking it, and now I'm up in the 50s. But like you were asking, I still don't know if we should trust those levels. I mean, Michael suggested it might be optimal bone health, but I'm still unaware of the studies personally. Doesn't mean they aren't out there that show that.
Well, it's so interesting to me because a lot of times, when we have a prescription drug, I'm thinking of, lisinopril or metformin or something very basic. The patient's overwhelmed by the side effects, but I'm so confident because they've done a bajillion studies on this, and I know the right dose to recommend, and I know what's going to happen. And if there's going to be problems, I can watch for them. With the supplements, it's tough because since they're not branded, there's not really that same profit motive to get things approved. We don't have good data. So I feel a lot of times inadequate to make really good recommendations. So I really appreciate Michael's insights. And I think we're kind of crafting a little bit of how doctors think about vitamins. And it's sometimes a lot of ways different than how patients think.
So your top 3 takeaways.
Well, I guess number one, kind of the punchline, I think, if there is one for the show, is that if you are not deficient in a vitamin, you probably don't need it, which is a gentle way of saying you probably don't need to take it. Americans spend $50 billion with a B dollars on vitamins every year. Give it to poor people. Don't buy the vitamins. Number two, there's definitely some dangers. I think a lot of patients I talk to feel like taking vitamins is a safer way to go than taking a prescription medicine because they don't have side effects. And what I would say is that they if they're working, if they're doing anything at all, they have side effects. And as Michael pointed out, even sometimes, unfortunately, adulterations. So be careful what you're taking. Be aware that there might be problems with it, and check for that USP label that he mentioned. That would be one of the more reputable vitamins if you're buying something.
And that stands for United States Pharmacopoeia. So that was a good tidbit that I heard. And I'd like to augment what Andrew said on both his first 2 top 3 points. And that was in the study I quoted that gave me that 24% answer. The people who did the study said most people have no need to take vitamins, and they said are wasting their money on supplements that are unlikely to improve their health and may actually harm it. Some of the examples I gave is that some of the supplements can decrease the effectiveness of common medications such as warfarin or Coumadin, insulin, and Xanax. So there is that.
Yeah, and everybody wants their Xanax to work. Trust me on that one.
Your third
point number 3, just kind of a good disclaimer. Go talk to your doctor. If they're your doctor, you better trust them. And if you trust them, listen to them. You probably don't need all these different vitamins. And if you do, they'll tell you. And as Michael pointed out, there's a time and a place for them. But this is not some kind of. I had one patient who was on several medicines. I was sad to hear that she put them all in a jar and took a handful every day. And I said, I hope they help. And I said, you can't do that. But that's what people do with vitamins, right? They take a handful every day and say, I hope they help. So don't do that. Talk to your doctor, and you're going to be better off for it.
And thank you for being with us through another episode of Dr. Doctor. You can find this and all our episodes on our website, drdoctor.org. You can search our episode archive and find what you want by searching for guests or topic of over 300 episodes.
And if you want to see the background of our recording studios, me in my dream library, which is actually a closet with a backdrop, check out our video version.
You haven't read all those books?
Read them. I own them.
I own them. Thank you, Joseph Pierce. No, this is Dr. Tom McGovern.
This is Dr. Andrew Mullally signing off until your next dose of Dr. Doctor.